Welcome to the next segment of our learning series on team-based care basics. This program is brought to you by our regional chronic disease collaborative partners in Alaska, Hawaii, Montana, and Wyoming. In this segment, we will review how to sustain team-based care workflows and services with revenue generation, cost-saving strategies, and continuous quality improvement. In the last segment, we developed and implemented our plan. We worked to create a psychologically safe environment to support our team, and we established baseline data for our performance measures and began the pilot testing of our team-based care services. In this segment, we will track and monitor our performance, use continuous quality improvement practices to adjust and improve our delivery, and identify ways to sustain our team-based care services delivery. In this learning series, sustainability is defined as addressing the financial ability of a healthcare organization to generate enough revenue to cover costs, invest in resources and staff, and continue to provide quality care to their patients. Return on investment shows how much value you get back for each dollar or the effort spent on something. It can be as basic as dollars out versus dollars in. In healthcare, ROI might also be measured as medical costs avoided, reduced absenteeism, improved health outcomes or access to care, increased engagement, or positive experiences, among others. Understanding and responding to the reality of financial pressures through increased efficiency and enhanced revenue capture is what makes clinical changes possible and sustainable. We can do this by understanding our organization's unique financing structure. Our organization's financial structure may be made up of a combination of these payment structures, among others. We should examine our payer mix and learn what types of practice activities generate revenue or help reduce overall costs. With fee-for-service reimbursement, we will generate more revenue by using our care team as a provider extender, enabling more patients to see the provider for a billable visit each day. For organizations that accept risk for patient costs, we will want to ensure our patients know how to best manage their conditions, make use of preventive care, and avoid specialist or emergency room visits, which drive up costs. Because the business of healthcare is to deliver the highest quality care to patients, improving clinical performance should be our driving focus. Offering these services can help improve clinical outcomes and effectively reduce costs by proactively managing conditions. They may also be revenue-generating opportunities. The Primary Care Team Guide has more recommendations on how to help sustain team-based care. Under the Support the Team section, you can select the Paying for Team-Based Care Learning module. This module provides an overview of paying for team-based care and links to related tools and resources. Based on the composition of our team, we can identify assignments that best utilize their skill sets and can help improve clinical outcomes, while offering revenue-generating or cost-reduction opportunities. Activities such as patient outreach and care coordination and care management. There are many workflows and assignments associated with these services that can be distributed effectively across our care team. Our team can also help perform services that support population health and chronic disease management. Our team can also help our patients use self-management tools and programs, identify gaps in care, help connect patients with needed services, and help build relationships with other service providers to more effectively address social determinants of health. Another way to sustain team-based care is to use continuous quality improvement to identify, test, and implement changes that result in cost reduction. Continuous improvement is an ongoing process of identifying, analyzing, and making incremental change, with the goal to enhance efficiency, quality, and value. It helps focus our team on improvement by constantly looking for ways to make things better. As part of the design and implementation, we have already established the foundation needed for continuous quality improvement. Through our process, we established goals and associated performance measures. Established the baseline data so we know our starting point for each performance measure. We implemented and tested our changes. And we established processes to collect and track our performance. We will use all this information to identify and implement quality improvement efforts to improve our team-based care process. For a deeper dive into using quality improvement to sustain and advance our team-based care services, we might access the Quality Improvement Basics Learning Series. It includes how to use the PDSA cycle for improvement, how to monitor and track data, and use it to support ongoing quality improvement efforts. A link to this resource can be found in the description below. Refining our team-based care services is an ongoing endeavor. We should continue to use the PDSA cycle for improvement to add new services and test new workflows and processes. Continue to cross-train our team members to help build capacity and resilience. Continue to build a psychologically safe environment. Encourage high-impact feedback from our team, our patients, and our partners, and use it to make the process better. And we should revisit our original goals and explore other ways we can expand team-based services for our patients, practice, and community. These are the calls to action from this segment. Identify revenue-generating and cost-saving opportunities to help sustain it. Establish a continuous improvement process to improve and advance the use of team-based care. And revisit our original goals and look for additional ways to expand our services. Congratulations! We have now completed all the steps to design a model, establish our team, and implement and sustain our team-based care services. In the next segment, we will provide recommendations and suggestions for how our care team might work beyond the clinic and into our community. Thank you for joining us.